Hi, everyone. My name is Leif Sorenson, and for those of you who don't know me, I'm a current undergraduate and master's student here at the University of Utah. And I've been working at the Center for Global Surgery for a couple of years on different projects in Mongolia and Cambodia. And specifically today, I'm going to be talking about advancements in laparoscopic training, updates from a pioneering program in Cambodia. This is a current project that we've been working on for the past year and a half now. And so I want to just give you some background on Cambodia. Cambodia has a population of over 16 million people. There was no in-country laparoscopic training program formally when we first partnered with them. When we came in, we helped establish three training centers, our first one being in Phnom Penh, the capital city, at Calmette Hospital, which is the largest public training hospital within the capital in the country. We partnered with LDS Charities, which is the humanitarian arm of the LDS Church, where we started with a 3-year proposal from 2022 to 2025 to see if we could actually build laparoscopy within Cambodia and view the health-related outcomes and see if it's possible. Since we first started in 2022, we've hosted 5 training courses, 3 of them with us coming to the country to help, and 2 of them being hosted within the country by themselves using curriculum built in collaboration with us. And then finally, our focus was to kind of help facilitate laparoscopic cholecystectomy education on how to do the surgery safely. Previous, like you had talked about in the other study, finding ways that we can kind of reduce mortality and injury. So as this has been going on, this is kind of a snapshot of what we've been doing, especially our most recent trip as we've gone on 3 now. So for the most recent trip, the methods, 2 of the main things that we tried to do was create a laparoscopic skills evaluation rubric and program that allows us to track within the training boxes, the surgeons and the residents, times and the scores that they get on the different various tasks, and then create a data bank for the patients in areas that currently don't have online capabilities or are using, paper to write down their data bank for their patients and operating logs and keeping track of that, trying to move them to an online or more accessible method. So what we did for the skills evaluation is I created a QR code, and we used REDCap and various methods, but I think we found the best one right now has been Google Forms, actually, because most of the people in Cambodia are familiar with Google and have a Google account. But REDCap, we really struggled with trying to get them through all of the preemptive, agreements and things that they had to do, because most of them don't speak English. So finding ways that we can manage that was a huge task for us. And so using Google Forms, the most recent trip that we did, we went to Calmette and Kampong Thom, and those are 2 regions within the country of Cambodia. And we test them on 4 different skills this most recent trip, and they're similar to the FLS skills. So circle cut, we did a rubber band transfer, as you can see, and then a task that I created that's called needle through loop, which is a task that you see in the top right corner, trying to give them a manipulation using both hands and get an idea of how throwing a suture would feel through metal circles. So within Calmette Hospital, we have a lot of the data, but I didn't want to overwhelm you. I'm just looking at one specific task, and that was that needle through loop I talked about. Within the needle through loop, after 1 hour of practicing, we did a like their first attempt and then a last attempt course survey. You can see the average starting time was 294 seconds. That's how long they took. After 1 hour of them attempting this, it was down to 267 seconds. That was a difference of 7.4%. And we have this data for all the tasks, but just showing that, in fact, having actual people on hand to help train and show how to do these tasks is showing that they can, in fact, decrease their overall time and improve the scores that they get. Then we went to Kampong Thom and Kampong Cham, and Kampong Thom is a new provincial hospital that we, although are not starting laparoscopic surgery in quite yet, we are doing a pilot program to see, is this training course well received? Is it something that they're interested in? And are they able to go through the course successfully and complete the tasks at the given times? And here's a picture of the team. So within Kampong Thom, we had 4 surgeons that were there. Within those 4 surgeons, one of them being the youngest, has been great and stayed up to date with keeping track of his times for the past 2.5 months. So the other 3 sadly have no longer input their times as they keep going, but one surgeon has. So it's been really cool to be able to watch where every week this surgeon comes in and practice the 4 skills and to be able to look at their scores and their times. His name was Mao. And so you can see for extracorporeal knot tying, his very first attempt, and then every 1 week, the attempts that he's come and done, and the total times that it's taken. And then that same attempt with the needle through loop, that task I had mentioned previously. For the first attempt, 791 seconds to then starting to average down around the 200 seconds. And it's really cool to be able to track this data here in the United States in Salt Lake City while he's doing this in a rural hospital in Cambodia. Then finally, and probably the biggest data collection point that we've been working on is in Kampong Cham. The LDS Charities helped rebuild a brand new hospital that we've been working at and building laparoscopy. And within that, they had previously kept track of their laparoscopic cholecystectomies all by paper. And within that paper, it was actually written in cursive French. So the way they had learned to keep track was within French. So trying to manage and do a Cambodian or an English online accessible, data bank has been a huge challenge. And right now what we have that's worked the best more than REDCap or other free programs has been Excel, because they have some experience in Excel and trying to build an Excel spreadsheet where it's not great. And we hope to find ways that we can build a more sustainable and kind of long-term program. It's what we found right now. So there's a lot for us to learn from the Gecko study as well. And what is to be collected and what's the best methods. So you can see there's a picture of kind of what it looked like, and we had to take pictures of the whole operating logs to then what we've now done with the past trip, where we've collected now 1 year of cholecystectomies. And so in 2022, they were just doing open cholecystectomies. Oh, sorry. For 2 years, they were doing open cholecystectomies at Kampong Cham. And we came in the February of 2023 on our most recent trip and did a 2-week intensive train the trainers and work with laparoscopic cholecystectomy. And so you can see that blue line is the 2023 when they started laparoscopic cholecystectomies in February. 2022 is the open cases they did before we came. And then 2023 were the cases that they were unable to approach laparoscopically, and so they did open. Within 2023, they did 116 cholecystectomies laparoscopically, and not only, but 2 of those were switched from laparoscopic to open, 1 in April and 1 in June. And so we're still following this data. This isn't even a full year out. As you can see, it's from January to October, but it's really exciting because we're able to see trend lines in the amount of cases that they're doing, the safety, looking at the patient outcomes, and making sure that what they're doing is safe and is having good health-related outcomes. And so the conclusions, just so far, in Kampong Cham specifically, the number of cholecystectomies done has increased 163%, with all of those more or less being done laparoscopically. We've seen now that the surgeons in all 3 locations that we've done this training program have improved times and improved scores within the training boxes, and that the surgeons now have an expanded knowledge of laparoscopic surgery and are capable to do different approaches and different types of surgeries than just open. Obviously, there's a lot more for us to do. Our future plans are to continue to expand this program and to follow the patient outcomes and the course efficacy to make sure that what we're doing is safe and that it has good health-related outcomes. And then to create maybe a more advanced laparoscopic course. In Calmet specifically, the capital city, they're very hungry and eager young surgeons who are looking to do more than just laparoscopic cholecystectomies and build that program out to a more advanced program. And then finally, to take all of this data and to publish our research and what we've learned. I'd like to thank some of the doctors here. This is the Utah team specifically. There's a large team involved, but everyone has been handling different aspects. And I'd like to thank the LDS Church for obviously sponsoring and paying for the program that we're doing, and all of our Cambodian colleagues that are working with us on this. So thank you all. If you have any questions, please let me know.